Okay, it's Jared Moore again, and this is Live Wire. Today we're going to be talking about the MCN Diabetes Program's Diabetes Awareness Virtual Summit and some of the things that have changed. We're going to we have with us today Duane Meadows. He is a Health and Wellness Coordinator with the MCN Department of Health. And Duane, thanks for joining us today.
Jared, thanks for having me, man. I appreciate this coming on here. It's been a lot of help over these past few years for us.
Absolutely. Well, you guys' program is very important. And could you kind of give the audience, if they don't know, if they've never heard of the Diabetes Awareness Summit, what is it and what's the purpose of it?
So this month is November, which is National Diabetes Awareness Month. And so for this month, we got to share our Diabetes Awareness Summit virtually through our YouTube channel. Now, in previous years, we usually try to go to one of our Muscogee Creek Nation community boundaries and have a actual summit, live summit, where we have presenters come in and we present our information to people coming, community members coming to the sessions. Of course, through the pandemic, we've had to change that plan these past 2 years, and with your help, Jared, we had a few discussions last year, and you came through for me on that with making some videos, helping us make our videos and our presentations go live. And we mainly did those videos at that time through Zoom. And this year come about, and we went through the same process again. We were hoping we were going to get to have a live summit, but we had to go virtually again. And again, I went through discussions with you, Jared, and we started creating the videos again. But something that happened this year that you really helped me with was creating the YouTube channel for our programs, NCN Diabetes programs. So with Mvskoke Media's help, we were able to put that together. And, it is a process. It's a surprising process.
Absolutely.
Of getting through that. And downloading those videos can take a long time. But through that, we were able to get those videos downloaded. We created a virtual playlist. We have 6 videos this year going on, and people that are watching the video, normally, let's just say this, normally at a live summit, we have about somewhere in 200 to 300 participants come to those events. Mm-hmm. And, the motto of the whole thing is to know and to be strong. That's what we want you to do. We want you to know and to be strong. Right now, during the pandemic, we want everybody to stay strong and healthy. So now we're going to give you the know, and we want you to stay strong and healthy. But for the virtual summit, just this past month alone, we've had over 1,080 views on those 6 different videos. So I think that's very impressive, and that helps us a lot. So the thing about, when we go to a live summit, we're thinking of prizes and gifts around 200 to 300. Well, each clinic area this year, we gave 100 prizes to. Now,
wow.
I want people to be able to get a prize. So to do that, they need to watch the playlist. They need to watch all 6 videos on the playlist, complete the survey, and you can, technology is so different these days. You can take your cell phone and take a picture of your survey that you complete, send that to me by email, in which the flyers on there, you've helped me with that, has a hyperlink to all of our emails, have a hyperlink to the flyer, has a hyperlink to the survey. Access to everything is very simple through this channel to go get it. They send that to us, we contact them, we get about the prizes. Everybody at each clinic area has over 50 surveys back, so that's like over 250 surveys back. We got over 1,080 views.
Wow.
There, so it's going pretty well so far. So I'm pretty happy with it.
Awesome. And for the audience, the link to that YouTube channel for the MCN Diabetes programs is in the description. I also popped it in the chat. So, because I know the previous year, the first virtual summit, we posted all those videos on Mvskoke Media's channel, and then you guys shared them through your Facebook and everything. And so we got a lot of people who were subscribers to our channel already who, because of that statistical correlation between the diabetes rates with Native Americans, that they were interested in this content. And so it was great that you guys this year were able to set up your own YouTube channel, and I saw that you guys have been making some posts in addition to what had been made with the playlist. So are you guys gonna make some more posts, or is it gonna be like a regular updated thing?
So as you know, our keynote speaker this year is Native Chef LLC Jason Champagne. And the feedback that we've been receiving from everybody watching these videos, they're loving his recipes and they're loving his own testimony with diabetes that he has on there. So we got quite a few more. I've received probably from Jason. We've gone out and got 11 more recipe videos. We got the essentials or how-tos in the kitchen, like how to use a knife or what cooking, like what kitchen utensils we're supposed to be using and how to be using those. So I created, or with the help of Jason too on this, we created a playlist strictly for the Native Chef. And throughout the months ahead, I'm going to keep dropping 3 or 4 videos at a time. I talked to Jason yesterday. He was at Kickapoo Tribe doing a presentation with them, and it was a virtual type presentation, but it was a drive-through. He was bringing food for him on a drive-through. And he's going to try to do us a holiday special, like a Thanksgiving theme.
Oh, cool.
Christmas theme, Easter theme, things like that. So we should be able to share those. So that's a playlist I'm going to have on there. And you know, I mean, just to mention to you, I know you and I have talked about this before. I'm trying to get into those clinic areas with their waiting rooms, because most of them have TVs in those waiting rooms. Like yesterday, I went to the Sapulpa Clinic. And they do have a video feed in there where I have connected our YouTube playlist to play. But the thing about the playlist, and maybe you can teach me, I just wish I could make it repeat over and over again. So
right.
Or somebody has to go back in there and hit play again.
Gotcha.
So I'm trying to get that working out at all the clinic areas, but you know, it's a slow process. I just got to physically go there and try to make things like that happen. Now, you know, we have our movement programs, our hop to stop programs, where we are in the schools. And this past 2 years, you know, because we can't go do group event type things, we can't go into those schools. So we have created a few of our activities and created videos from that. We've created some of our lessons I got with our dietitian, Rachel Valsaraw, to help me with audio for my lessons 4 and 5 on that. And then we've given those lessons in that playlist to those schools, and now they can just click on those videos and play it in their school. And we're trying to keep those lessons, you know, when I'm 2 to 8 minutes. They're not very long.
Right.
Pretty simple and go through it. And that's the same thing with the recipes for Jason Champagne. We're trying to keep those under 15 minutes when people can go in there and watch that recipe. And then I have all of the recipes that he's made on a file, but I haven't dropped, you know what I mean? I haven't shared that yet. That's something else. Right. Where people can click on there and get what recipe they want out of there. There's a lot that you've helped us with that this YouTube channel can do. So
yeah, and you know, while we're chatting, you know, that one of the things we did is we're running a series now with the language program on the language, right? And we're trying to get all of the virtual episodes that they've been doing, where they've been doing these Zoom classes for employees of the nation to learn the language. And we're trying to do all of them. We started out with just one 6-week thing, but we're trying to do each 6 weeks because there's different levels. And so one of the things that we did, or that I did with that, was I created a Google Doc, right, that I could put a link into the description of the videos, all the videos. And the link will stay the same, right? And you can drop files into that Google Docs file and update that file all the time. So it's like for your recipe situation, you could try to set that up to do it like that. And then that way, somebody who watches the video can just go to that link and get the PDF or whatever for the recipes and all that.
And that's what I was going to save them, all as PDFs. And like you said, I created that file, like you mentioned there, just for the summit. And I thought I could try to do the same thing that way. I just didn't know how to put the links inside the videos where they could click on the video.
Oh yeah, the little tag things. That's we can. I think YouTube still does that. I don't do that a lot, but it is a possibility.
It's possible. I've seen it on some.
So if somebody watches the playlist, right? What are the videos on the playlist? What topics are covered?
So you know, you got Jason Champagne, Native Chef. He's doing that managing diabetes with whole foods and exercise. And then you got most of our staff members with Mvskoke Creek Nation doing the other presentations. Like Rachel, that dietitian, she's doing that snacking made simple with my plate. I mean, you know, Kim and Morgan, they're doing that family fitness at home. You got to help us with that video, get that one created. Connie Berryhill, our new acting diabetes manager, she's doing that taking charge of your health on there. Lacey McCoy and Angela King. Angela King's our stroke prevention nurse. And she's doing the diabetes and stroke topic on there. And then our great partnership and relationship with behavioral health, Tyler Stone, is doing the It's Time to Get Serious About Our Mental Health. So very great topics. Want people to go check those out.
Absolutely, sure. Yeah, for sure.
I do want to share with you, because we still have some prizes in each clinic area, what the prizes look like.
Okay,
if
go
they
for
complete the survey. So I don't know if this will it share it? No, I don't know how to make things show without showing my face.
well, where could they go? Is there a website for the Department of Health or something that has the prizes, or flyer somewhere? Maybe you guys' Facebook?
Yeah. So if they you know how they can click on the hyperlink on our flyer, click on my email that's on that hyperlink, I'll send them a picture of each one of these things so that they can see it. I mean,
so to get the prize, they got to watch the videos, do the survey, and then their name gets entered, and their email gets entered into a thing, or how does that work on the back end?
So on our side of it, each clinic area has 100 prizes.
Okay.
So if they complete that survey and get back to us, the first 100 people that complete it will get a prize.
Oh, okay. So you just got to do the survey.
You just got to do it. Well, you need to be
first.
Yeah. Watch the playlist, get a survey. Make sure you live within our Muscogee Creek Nation jurisdictional boundaries, and you are a Native American citizen, you know, on there. And if you're not, you need to be a support personnel for somebody who is. And then you get the survey. But, you know, they'll contact us. We'll go over that.
Is there, on the prizes, do they need to go pick the prize up, or does it get sent to them?
Most of the time, what we do is, like, say, for example, I'm at Sepulpa Clinic. I'll just come by the clinic and pick it up. Or if I'm traveling to Bristow or over to Okemah, I'll drop things off at Bristow for people.
But and with the different clinics, is it a situation where somebody can be from, like, Tulsa District and get a prize from Sepulpa, or do you have to be in that district?
So say they're Tulsa, then that would probably be my person that they'll connect with. And that's how they've been doing it so far. They can see on there that, I'm in Coweta, well, then I need to contact Morgan. I'm in the Eufaula area.
Oh, okay, I see.
And I contact Kim.
All right.
I'm in the Okemah area, get a hold of Tori, things like that. And ultimately, you get a hold of William.
Okay.
In that area. So, and it's on there that way to click or contact us. And that's the thing I like about a cell phone. They can take a picture of it and send it right to me.
Right. Well, and I want
print those off.
Cool. And I want to take a quick pause here to let the audience know that if you have any questions, you can pop them into the YouTube chat. We're talking about the MCN Diabetes Awareness Virtual Summit for this year and last year. You know, before we had the COVID situation, and I remember the diabetes summits were like a big event. Like you were saying, there 200 or 300 people would come to this. And we used to go and even record and do news pieces on the summit because it was you guys would always have a venue and all of those things. Going forward, hopefully we can maybe get back to that. But if they don't, you know, like, are you guys gonna like continue this trend that we're seeing with the virtual summits and like, is the summit going to get expanded out? Because from our perspective of our YouTube channel, what we've been doing for so long is, like with the Live Wire, we're trying to bring in more audience interaction where the audience can ask the questions in the chat. And with you guys, you know, like right now, you know, last year we did the videos that are like prepackaged videos. You know, we record a presentation, we edit stuff, then we upload it. And then, but the summits in the past, right, were really interactive with the audience. They would get up and do stuff, and they would also be able to talk to the presenters, like kind of in an informal way at the thing. I guess my question is, are you guys have any plans to incorporate live streaming maybe for next year? Or like, is this like, because I know you guys aren't really budgeted to do the YouTube thing. Yeah. So what do you think?
I like that idea. I do like the interaction that we're getting from the people that we sometimes can't reach, that the YouTube channel is allowing to happen. But we definitely want the live event. We want to be there, the physical location. I mean, we love the Glenville Conference Center. It's a beautiful location to have these summits at. I mean, we've had it at Muscogee Civic Center before, but we do have iPads, and I do think I could do a live stream from the event. I could see us or me and you working together, going around asking questions with our live stream, because I like the idea of keeping that material, that video together for people to go hit and watch later. So if we could physically video some of the sessions at our summit, it's something that we can always have people go back to and play. You and I have had this discussion before.
Yeah,
it's a fantastic idea. It needs to evolve, and this will give us a great way of doing it.
Well, and I think for you guys in particular too, because we're talking about diabetes, some citizens or people that are going to the clinics, they just can't go out, like they can't travel or anything, and it's like that. Apart from the people who are coming to the summits pre-COVID anyway, like it seemed, I was very surprised. We put those videos on our YouTube, and I was expecting to have some comments, but we were getting comments from people that don't look to be citizens or Native American. They were just like, "This is great, thanks for posting this video. It's very informative." And I would say too to anybody watching, go check out their channel. The links are in our description and our chat. And also, if you want to, go look at last year's summit, because there's a lot of really interesting information that maybe if you're into science and you don't have diabetes or any health problems, if you go look at the videos, though, the science is being presented by somebody who knows what they're talking about. They're a specialist in the field, and they're also kind of they explain how diabetes affects specific parts. Like last year, I think we did the one about your vision, and there was a presentation that talked about how diabetes affects the function of your eyes and the structure of your eyes and all of those things. And I was in the editing it, and I was like, this is really interesting, like I'm just piecing it together. I was like, this is like a program that I would watch on YouTube about like how your eye works and everything. So it's really good science content apart from it, outside of even if you have diabetes or not. So I just wanted to thank you for coming on today. We're getting closer, like it's 17 minutes, and I don't see any questions from the chat. If you guys have any questions for Duane about the virtual summit, pop them in the chat. But is there anything that you'd like to mention that we haven't talked about yet?
You made me think of it. So, like last year's summit, we try to tie it to our EPIC Session 4. It's a lessons that when people that come in with diabetes, we want them to know those topics, hit those topics where, the dentist comes in, the eye doctor comes in, foot carers comes in. So that's a playlist I'm going to put together as our Session 4. And you think about that, before we were having these people come into the clinics, and it's been a tough time trying to get people to come into the clinics, and we're having to share our computer or share a flash drive with them to go watch that video. This YouTube channel is now going to give us a link just to share and say, hey, watch these videos for us, and it can help with that EPIC Session 4 lesson. So that's our next move that we're going to do with those videos. So
it's kind of like the user manual. If you develop diabetes, it's like you need the user manual to figure out, what you need to do to preserve as much function and everything that you can, or reverse some of the symptomology that can happen there.
So it's useful. It's going to be helpful. I appreciate you having me on here.
For sure. And in the future, if you guys, anything that happens with your channel or with the program or anything, and we talk on email all the time, like I think what you guys are doing really is very important. I think there's so many things that happen in the health system that from the aspect of the people who are working in the clinics, maybe it's like a niche thing. But it really is applicable to everybody. And getting that content out there even broadly, you're going to reach more people and maybe show them, hey, because there is this cultural misperception, in my opinion, of Indian clinics, like what the experience is like, and that it's kind of like a negative stereotype of it. But if you actually go to the clinics or you actually see the services that they offer, it's like you're like, whoa, this isn't like the way it's portrayed at all, honestly. And so I appreciate what you guys are doing, and we are at 20 minutes. So, and if there's nothing else that you'd like to add, I'm gonna go ahead and sign off because I don't have any questions here, and I've kind of covered everything I want to cover. I do want to mention to the audience that we're going to have another live wire next week on Wednesday. I think it's at 1 p.m. And we're going to have Turner Hunt on. Turner Hunt is with the Cultural Preservation Program of the Muscogee Creek Nation. And he's written a really interesting article in the newspaper that I encourage everybody to check out. That's about NAGPRA and things that the tribe is doing to combat universities that are denying the return of remains. So if you want to tune in and ask some questions to Turner about that, and the paper, you should have the paper now if you're a subscriber that has that article in it. Go check that article out, get some questions, and pop into our live stream and ask questions of Mr. Hunt. And again, Mr. Meadows, thanks for tuning in today and coming into the Zoom, and I look forward to working with you in the future, sir. And
thank you.
With that being said, I think we're going to sign off for today, and we will see you guys next week. Mado.
Do I leave now?
You're